The next and final question I'm going to talk about today is postcode. This one is slightly different, but also really, really important. So capturing postcode allows a better understanding of variation in terms of geography. It can be used to identify differences in impact or any gaps. If you're doing an intervention, for example, in a particular ward or a particular constituency. In terms of what postcode actually is, the first section is the broader area, and then the second section will focus in more on where people live. We're asking people to collect the whole of the first question, the first part of the postcode, and then the number of the second part of the postcode. And I'll come on to why and give an example in the following slides. So you can see there, I hope you can sort of see it, the map on the left. You can quite clearly see there that the B postcode covers much more than Birmingham, so down into Redditch and then into Solihull as well, and then even up to sort of Tamworth as well. B98 is Redditch and B90 is Solihull, as it says there. We also know that there's such variation in the size of that first half of the postcode. So, for example, I think is it B75? I'm not sure it is B79 actually. In Sutton Coldfield, there's one in Sutton Coldfield which has 34 square miles, whereas B7 in Nechells is just 1.5 square miles. And again, as it says on the slide there, this is because postcode size is linked to the number of households in the area and not the geographical size. So if you're doing some sort of intervention or providing some sort of service, it's really important to understand that variation or understand uptake in different areas, which is why collecting postcode is so important. So as mentioned, what we're looking for with this question is the first half in full. So it's just given an example there. So if we take the council house in Birmingham, which I believe is B1 1BB, so what we'd want there is the first half, so B1, and then the first number of the second section. So for the council house, this would be B1 1 is what you would collect. And then there's obviously that do not wish to answer option, which should be throughout every question in all of these measures for the demographics, for the standard questions. So in terms of why we're collecting first half and then one digit, the reason for this is that when this was tested with communities, people felt more comfortable providing this information rather than their full postcode. However, to get any real sense of geography, we do need more than that first half. So that's why we're asking for that. As you can see with that map, that first half provides actually little information to us, and therefore we shouldn't actually be collecting that because we can't really use it that well. So in terms of some specific issues to consider, as well as people not wanting to provide their postcode, some people might write the full postcode or confuse different parts of the postcode. I think with this one, it's quite useful to provide that example. So the B1 or just to give people a sense of what we're actually looking for. Therefore, it might sort of help them fill that in. So those are the three parts to this webinar. I'm now just going to briefly talk through a case study. As with a lot of these slides, there's been quite a lot of text. I think if people want to go away and read at their own time, I've tried to include a lot of information in there. So yeah, there is a lot of text, but I'll just briefly talk through a bit of a case study for when this type of information would be collected and why it would be used. So this is an intervention which is a 6-week course for people at risk of developing type 2 diabetes. It's just a fictional one. Demographics questions will always be asked. So all of the questions in this webinar, the previous one and the next one, in 20 odd minutes, will always be asked. So in this example, the provider reported on ethnicity and found there were fewer people from the white Irish community than you would expect. They did this by looking at the local census profile, so some of those benchmarking links that I shared earlier. They might have also used the postcode of participants here to understand variation in terms of geography. So they are focused in East Birmingham, but they've sort of discovered that they've got lower uptake from a particular community. Knowing this information, they can then reach out and to different places. So here reference is the Birmingham Irish Centre to really raise awareness of the offer. So that's sort of as they are doing the intervention or providing that service. The other way to use this type of information is looking at the other characteristic, so religion or belief. The provider in this case, again, just a sort of a fictional example. The providers showed that people who identified as Muslim were least likely to complete the full 6-week course. And this is just an example of how we can use the questions to better understand the impact of interventions as we're doing it, but also afterwards, and really sort of measuring those outcomes and measuring our impact. So I think that's the end of the sort of content for this webinar. The next one, I believe, will discuss sexual orientation, pregnancy, and relationships and marriage. So I think we'll probably stop recording, and really happy to take any questions. I think we have a bit of time as well before the next one, so if anyone wants to